Hello and welcome to week 2 of What the Help, the Everyday Person's Guide to the Patient Protection and Affordable Care Act. Last week we covered the first 11 and a half pages, which make up the PPACA's table of contents. This week we're diving into Title I, Subtitle A, Immediate Improvements in Healthcare Coverage for All Americans. Now, because Subtitle A is huge, we've broken it into 2 parts. Part 1 today will cover Section 1001, which deals with changes to health insurance coverage for users like you and me. There are new laws that insurance companies have to follow, such as new reports they have to send out, and ways to ensure that we get the most value for the money that we pay them. Part 2 will cover Sections 1002 through 1004. The video and blog for that will be posted on Thursday. Okay, so on to the information. Section 1001 is called Amendments to the Public Health Service Act. Now, the Public Health Service Act is a law that was originally passed in 1944. It makes up Title 42 of the U.S. Code, and it covers all the laws in the U.S. that deal with the health and general welfare of the public. The PPACA adds the most substantial revisions since the Medicaid and Medicare Acts in the 1960s. In fact, the first few lines of Section 1001 in the PPACA deal just with what to rename the sections of the Public Health Service Act that this law is replacing. The new laws start with Section 2711. This section prevents insurance companies from putting lifetime limits on the amount of benefits you can receive from their plans. This means if you get cancer or have a child born with special needs, you no longer have to worry about maxing out your insurance benefits and possibly being dropped from coverage. There's also a part of this section that prevents unreasonable yearly limits. If you were on an insurance plan where you had very low benefits each year and you couldn't get much health care, you might see those benefits start to go up. Now, there is a loophole in this section. Any plan that's exempt from the PPACA's guidelines is allowed to have an annual or lifetime limit. We'll talk more about which plans are exempt, but keep in mind that it's a pretty special case. Section 2712 has more good news for those with serious or chronic health problems. This section prevents insurance companies from dropping you from their coverage except in cases of fraud. Before these laws, an insurance company could drop a person for a variety of reasons, including running up against a lifetime or an annual cap. Now, the insurance company has to prove that you committed fraud or otherwise misrepresented yourself before they can drop you from coverage. For those of you who don't have serious or chronic health problems, Section 2713 is where you need to tune back in. This section lays out which preventative health services an insurance plan has to cover. On this list are CDC recommended vaccines, well baby checkups, mammograms, and any other service that comes highly recommended by the U.S. Preventative Services Task Force. Now, this task force is a group of physicians and other healthcare workers that have been appointed by the government to review and grade all the preventative health services that are available. Any service that gets a grade of an A or a B has to be covered by your insurance company, and they can't bill you for it later. Okay, all the single people under age 26, listen up. Section 2714 is called Extension of Dependent Coverage, and it says that if your parents have an insurance plan that covers dependents, such as children like yourselves, that plan has to cover you until age 26. Some states even extend this coverage through their own laws, like New Jersey, where you're covered up to age 29. A few states even extend that coverage up to age 31. None of these plans are required to cover you if you're married or if you have children. Section 2715 takes a hard look at insurance company policies. Do you remember those 15 pages of microscopic print you used to get from the insurance company each year with your insurance card? The one that detailed all of your benefits but that you couldn't read without a magnifying glass? Yeah, those are illegal now. As of March 2012, your health insurance company has to provide you a summary of benefits that is under 4 pages in length, written in at least 12-point font, and in language that the average person can understand. In the US, that standard is an 8th grade reading level. This summary has to tell you what the plan covers, how much insurance will pay for each of those services, any limitations or exceptions in your coverage, and contact information for the company so that if you have any more questions, they can answer them. If you have health insurance, you should have already received an updated summary of benefits. If not, contact your health insurance company and ask to see them. Failure to provide this report can result in a $1,000 fine per person for the company. Okay, all the rich people out there, listen up. Section 2716 prevents a health insurance company from basing your eligibility on your salary or your hourly wage. Actually, all the poor people listen up too. Whether you make a ton of money or next to no money at all, your health insurance company cannot take that into account when determining your eligibility to have your services covered. Section 2717 outlines another set of reports that a health insurance company has to provide. During each open enrollment period, a health insurance company has to provide a report on how they're helping improve the health of their members, such as covering things like weight loss, stop smoking, or drug and alcohol rehabilitation programs. These reports have to be available to the general public as well. Failure to do so can mean more fines. Section 2718 focuses on the money, specifically how health insurance companies can spend the money that they get from our monthly premium payments. Section 2717 deals with the money, specifically how a health insurance company can spend the money that they get from our monthly premium payments. Health insurance companies now have to report how much they spend on claim-related costs, on programs that improve the quality of health care, and on non-claim related costs, such as paying their employees, paying rent on their building, and corporate bonuses. If a company spends more than a certain percentage on non-claim related costs, they have to provide a reimbursement to all of their plan members. Before you get all excited and start looking for a check, this percentage varies based on state laws. Also, the entire reimbursement policy expires on December 31st of 2013. What will remain in effect, however, are the laws on how a health insurance company can spend on monthly premiums, and a set of other laws requiring hospitals to provide yearly public reports on the cost of their services. Anyone who has gone toe-to-toe with a health insurance company over a claim, Section 2719 was written with you in mind. It requires a health insurance company to create an internal appeals process, as well as explain clearly to all their plan members how that process works. Companies also have to provide regular updates on an appeal's progress and have an external appeal process for all plans. Okay, I know that was a lot of information to absorb. Let me do a quick recap for you. Section 1001 amends the Public Health Service Act, which is the part of the U.S. Code that covers all the health and wellness laws. Among the changes are laws that prevent health insurance companies from establishing lifetime limits on benefits, from dropping you from their coverage except in the cases of fraud, and from discriminating based on your income. There are also laws that require plans to cover preventative health services as well as non-married kids up to at least age 26. Finally, health insurance companies now have to provide yearly reports to the public on their coverage, spending, and appeals processes, and these reports have to meet certain formatting guidelines. All in all, it's a lot of changes for health insurance companies, which can mean changes for your health insurance coverage. Since all of these laws went into effect by March 2012, you should have already gotten an updated summary from your healthcare insurance company telling you what the changes are for your plan. If not, contact your health insurance company and ask to see them. If they give you any trouble, maybe remind them that the cost of a postage stamp is still less than the $1,000 or more fine they're facing otherwise. So that's it. Check back on Thursday for part 2's video and post, and then again on Monday when we start Subtitle B. In the meantime, head over to www.saywhatthehealth.com to read the blog. And don't forget to subscribe to our channel here on YouTube to be notified of new posts. Stay healthy, and we'll see you next time.